We just added ABA, which is applied behavior analysis. It's basically a behavioral teaching method. And we added what's called discrete trial training, which is one-on-one, very intensive, starting off with basic learning skills, which is sitting and attending, looking at the teacher, imitating the teacher, doing what the teacher wants you to do. And then starting to work on, basic academic skills. We're working on, at this point, on some oral motor stuff, some fine motor stuff, identifying things receptively, putting things in categories. There's a variety of programs going on at this point.
Good job, Nick. Hey, Alex, roll the ball. Rolling the ball back and forth, it's called cooperative play, and it's just trying to get them to interact with each other or working on eye contact with each other and sharing toys, taking turns, that kind of stuff.
He's a completely different child. He evolves every few months into a completely different child. When I first started working with him, he had very limited language and he was very frustrated. His behavior was much different than you see now. He's now showing pride in his work, which is a big accomplishment for him. He is showing skills that he just did not have at all before. He couldn't answer any WH questions, who, what, when, where, why, or how. He just didn't understand anything abstract. But he has come so far. He's learning his letters, he's learning his numbers, he's excited about reading. He's a completely different child.
And how long do you foresee this sort of therapy, I guess you call it, or working together? Right. How long would that last?
I think he probably need a home program for the next few years, and I think he'll be mainstreamed in the next few years, and I think he'll need some sort of support for a while, but it's really hard to say. He's come so far already.
My goal for him is to be as happy and as self-sufficient as he can possibly be. I don't know what the future holds for him, and I think it's a protective mechanism in me. I don't look that far, but if he can be happy, if he can hold a job, and I don't care what kind of job it is, and just be happy with himself, and his self-esteem not be affected, because there are times when, because he's high-functioning, he knows he's different, and he knows he can't do certain things, and he can really go in on himself, and that hurts. I mean, I see it, and that hurts me. And he's in his own little world at that point. So if his self-esteem cannot be affected and he can just be confident about himself, that's what I really hope that we can accomplish. I'll balance his checkbook for the rest of my life. That's fine. His brothers can take over after that. But just to have him happy with himself.
What are my goals for my kids? I would like them to be able to talk. I'd like them to have friends. Regular kids as friends. I'd like them to be able to go to a sleepover without having to have an adult along, to be able to go to a birthday party without crying when everybody cheers at the end of happy birthday. We still have big issues with like going for walks. The boys still have no sense of fear as far as things like traffic. If you let go of their hands, they'll run into the street without thinking twice about it. They don't understand the concept of danger in that setting. So big goal for us is, we're working now on things like every time they get to a corner, we stop. We're working specifically on Donnie because he tends to be the one who bolts the fastest. We're actually working on a stop program for him, which is he runs away and you say stop and he has to stop. And we're trying to increase his compliance with the word stop. Because if they run away and they don't listen, obviously it's a big issue as far as getting them out in the community.